Being a nurse was one of the greatest experiences of my life. I loved what I did. I loved helping patients. I just started to understand that I wanted something more. I wanted more things out of life, and I didn't know where to go. Getting into medical sales has given me that inner ambition that I need to wake up every morning and have goals and be chasing something. I am a dog mom, a registered nurse, a beach lover, and a clinical specialist. A typical day for me as a clinical specialist usually starts with me waking up, drinking some coffee, checking some emails, looking at my schedule for the day, checking in on patients that are currently in trials with our device, and then setting out to go see doctors, help them implant our device in the OR. Say a patient comes in and the physician thinks that our device would be a good option for them. I come in, help the physician implant our device, so I go into the OR with them, make sure that we're hitting all the right targets for where it needs to be to touch on the specific nerve that we're targeting. And then afterwards, I work alongside the patient to program the device, make sure that it's at all of the right settings to be comfortable for them, but to also give them relief. And then I always tell my patients, I'm your point person when it comes to your device. If you're having questions about it, if you need help with it, if you're uncomfortable, you call me. So I'm constantly talking with them throughout the whole process, through the trial and the permanent procedure. Truly, I'll still have patients call me 2 years down the road if that's what they need. So from day one till the last day, I will be their person. So when I decided that I wanted to figure out what the rest of my career was going to look like, I started looking in medical sales. It was hard for me at first because I felt like I was leaving something that I really did love, and I was making a difference, and I felt like going into this industry was going to cause me to lose that, and I didn't want to. So it was really, really important for me when I was looking at jobs that I was still really involved with patient care, and that whatever company and whatever product I was selling actually really, really made a difference for people. And I knew if I could do that, but also get into the industry, that would be my perfect fit, and that's exactly what I did. A patient that I had last week, he has been in pain for 11 years now from his knee down. He had cancer, got chemo. Chemo gave him peripheral neuropathy. He hasn't been able to feel his feet or his legs in 11 years. We trialed him last week, and I was programming his device after the trial, gave it a little time to work, and he was sitting across the room from me and he started tapping his feet on the floor, and I kind of looked at him funny and he said, I haven't felt the floor under my feet in 11 years. And that was just like life-changing for me. I felt like it brought tears to my eyes because I felt like I couldn't imagine being in his position. He can't even drive a car because he can't feel the bottom of his feet. And he kind of looked at me like, I can't believe this is actually working for me. So that was huge for me. That's what I love to do. Getting into this industry was really scary at first. It's very intimidating. It's a much more rigorous interview process. When I was going through all of that, I remember studying for interviews like I would a test, like just preparing, understanding what I wanted to talk about, understanding what I wanted to learn about whoever I was interviewing with, just really being diligent about making sure that it was the right spot for me. So in preparation for the interviews, something that I did that helped me a lot was kind of a little bit of goal setting and a deeper understanding about myself and what it was that I truly wanted out of a role. Once you answer that question for yourself, then you can take time to develop questions that you want to ask them that will help you better understand if you are right for that role and if it is going to be something that you want. It was very intimidating because you think, you're a nurse, you don't know how to sell anything. But truly, if you're passionate about something, you understand what you're doing, you can have a conversation with anybody about it. So that's kind of how I felt, and that was the mindset that I had going through all of it. And I'm so grateful because it got me to where I am today, and I am so happy. I have consistency in my life. I work normal hours. I have flexibility in my schedule. I truly enjoy what I do, and it's not as emotionally and mentally taxing. It's funny because when I was going through all this as a nurse, I'm really, really close with my dad, and I called him one day after a really long, very hard shift, and I just was like, I don't know what I'm gonna do. I can't do this anymore. I gotta find something else. I just need to find another job, whatever it is, I'll just have to do it. And I remember him saying, he just said, stay your course. And I was like, stay my course? I can't stay here. I can't do this. There is no way that I'm staying my course. And truly looking back, that was the best advice that I could give myself, because everything that I did then prepared me for who I am now. And if I would have jumped into something else then, instead of waiting for what was right for me, I would not be happy where I am now. If I were talking to a nurse that's in my position that I was in then, I would tell them to not be afraid to let go of that. I feel like as nurses, we work our butts off and we go to school and study so hard and get this degree, and we feel like we have to be a nurse and that's what we have to do. It's okay to veer out of being a bedside nurse. It's okay to find passion in other things. You will still use your skills as a nurse, and there are other things out there that will allow you to do that. The lobby was my one-stop shop for everything that I needed throughout the entire process. From job postings to helping out with the interviews to, trying to help me figure out what it is that I want in a job and making sure it's a good fit for me, but also the role that I'm filling. The lobby was truly there for me from the day that I started the process until the day that I got hired, and honestly continuing on even through now. I still use the resources, so it's been incredible for me. Being a nurse gave me the chance to really develop the qualities that I needed in the role that I'm in now. Things like compassion, empathy, therapeutic communication are all really, really important. If I have a patient and our device doesn't work, it really affects me because I understand that they have been struggling and suffering and unable to do certain activities for so long. And sometimes our device is the last solution for them that they have, the last opportunity that they have to get those things back. So being a nurse made me a really empathetic person, but that makes me more successful in what I do now because I do care. I can see how they feel and I can see how hard it is. And when we have success in what we do, it truly changes their entire life. My name is Caroline and I'm a registered nurse that transitioned into medical sales.